Good afternoon, and thank you for tuning in here on WDRV Media, the voice of the community. I am your host, Doc Bowman, here on Discover the Best You. Tune in every Thursday at 2 p.m. So today we're bringing back on Miss Leslie Ware. How you doing?
I'm fantastic. Thank you.
You are very welcome. Tell them a little bit about you and how they can find you, and then we'll get started on our next topic of discussion.
Okay, so I'm Leslie Ware. I'm a physician assistant and I'm a health educator. I've been practicing for 20 years and doing community health education for 30 years. My areas of interest are diabetes, cardiovascular disease, and lifestyle-related medicine.
Mm-hmm.
So I have a practice, Alpha Health and Wellness, direct primary care practice, and do basic primary care from infants to the elderly. And lifestyle change is at the center of my practice concept.
Absolutely. That is awesome. And give them the phone number, how they can find you.
Oh, yes. You can reach me at 980-949-6000 and schedule a free consultation.
Nice. So we had a great conversation last week affiliated with healthcare, and basically we were just talking about the insurance alternatives to healthcare. So today we're actually going to be talking about opiates.
Yes,
dun, dun, dun.
hot topic.
Absolutely. That's like one of those topics that has been out and about for a while now.
Yeah.
So tell me what your personal opinion is about this opiate trend going on right now.
Yeah, it can get kind of dicey, but I'll try and keep it just
minimum,
kind of,
the
in the
CNN
middle.
version?
In the middle, right.
All right.
So I worked for a period of time in pain management. And I worked for an orthopedic group here in town. Mm-hmm. And that was kind of my introduction to not just the treating people's pain, but the other sort of problem that we're creating when we are treating people with opiates to manage a painful condition. And so there are a certain group of people who will be prescribed an opiate, mm-hmm. and they take it for their pain and they do just fine.
Right.
But then there are other people that don't really even realize that they're wired from birth to have
mm-hmm.
Addictive personality. And so those people will maybe even start off the same way, like, okay, I had a tooth pulled or I had a knee surgery and I've been given these pain medications, and mm-hmm. before I know it, I'm hooked on it, and then I'm addicted and I'm, pursuing some drug-seeking behavior, just trying to keep from withdrawing from the medication. And then that's a second group of folks. And then there are people that are just going about it for the use of it and abuse of it from the start. So all those folks kind of pour it into one little bucket. Right.
Well, chiropractic, we don't prescribe medication, so our goal is to treat the body without the use of medication. Mm-hmm. So we're more of the holistic approach, but we are considered primary care physicians, just like a medical doctor or a doctor of osteopathy. Mm-hmm. The thing is, DOs are not as popular on the East Coast as they are on the out West, but DOs is basically their philosophical point of view is in between an MD and a DC, a chiropractor.
Yeah.
But the opiate epidemic, I'm going to call it epidemic because you see it very popular here in the United States. There's a difference between an epidemic and a pandemic. So an epidemic is more localized in a central location, where a pandemic is all around the world. And a reason why I call it an epidemic is because United States, that's what we're known for, with writing prescriptions mm-hmm. and giving it to a person without trying to find a way of figuring out how to fix the problem without giving them pain medication all the time.
Yeah. And there's this like burden of responsibility that I think some providers are kind of, they fall into this trap.
Right.
We take the Hippocratic Oath, which means mm-hmm. that we are going to manage people's pain and suffering along with their diseases. Mm-hmm. And then we live in a litigious society too. So we're afraid that someone's going to, say, hey, you didn't manage my pain appropriately, and how can you let me suffer like this? And so,
I
that's
think
part of it.
A lot of it right now at this point, it's about what you know, and social media as well as YouTube and places like that. People are starting to become more aware And then a lot of them are starting to realize, like, hey, I think I'm hooked on this.
Yeah.
Yeah, they're starting to recognize that. Didn't know, they thought it was the norm, but now finding out that that is not normal.
Yeah.
Yeah. And like I had one or two situations where a patient was coming in, and I started looking at the different prescriptions they were taking and their blood work, and I'm like, good gracious, that's like, what are your doctors looking at each other, what they're doing?
Yeah.
And I would assume and hope so they were, but I mean, like, one of them was taking so much that he was able to knock out a cow.
Okay. Yeah, that would be kind of scary experience when I would see folks come in that were not on, they may be on 120 milligrams of oxycodone a day.
Right.
They may be on, a fentanyl patch, gabapentin, some muscle relaxants and things like that, all of that, and the benzodiazepines that go along with it. So those people are clearly impaired, but how to get to their appointment somehow, right? And they have to get back home somehow. So I think that it is just a huge problem, and it's also a multi-billion-dollar business industry. Yeah,
absolutely,
yeah.
It is. I mean, again, I know we talked about the health insurances, but we can also talk about the pharmaceutical concept as well. I mean, they all come together, and like, it's just a billion-dollar industry, but again, it's making all of us broke.
Yeah.
So,
it's keeping some specialists, in business,
especially the ones affiliated with the pain.
That's right.
And unfortunately, this country is based off of pain, and we definitely got to start switching that concept around, because we're making people money, but at the same time, we're making people sick
and die.
Right, which is costing us money.
Right.
So you got to look at the situation on hand to hand on both ends of the stick. And again,
I read that there are some countries that don't use pain medicine at all. Like there are none available.
I'm pretty sure, especially in the Asian.
In the Caribbean, the parts of the Caribbean, they don't use pain medicine. And so that kind of just makes you realize that we live in a consumer-driven kind of a country,
right?
We want what we want, and there are people out there who can make buck off of what we want, and it's a vicious cycle.
I mean, it's just, you got to make a buck, but I mean, you try to make it where it's the right way.
Yes.
That's the way for me to try to make it the right way. But I think the model of healthcare, I don't know of really any country in particular that you can really say this is the main one. I know France got a good governmental program, and I know Canada got that governmental insurance.
Oh, right.
Yeah, so certain countries have those governmental insurances, but I don't quite know how their concept of
I traveled to Canada a couple years ago, and I was sitting in the hot tub, and it just happened to meet the past president of Bayer Pharmaceuticals, and we got on that topic about what's the difference between healthcare in Canada versus in the United States. Is one better than the other? And his take on it was that each has its benefits and its downsides, and that the benefit for America is that we do have a lot of technology. We have a lot of advancements that other countries do not.
Right.
But the downside of that is that our healthcare, particularly health insurance, is just so complex. There's so many layers, and there's a huge lack of transparency.
Right.
That makes the consumer sort of 10 degrees separated from their healthcare dollars and experience.
Right.
Whereas in Canada, it's it's not all free. It's not all socialized. So you pay the price if you have something basic going on. You need to see your primary care.
Right.
Sure, you can get right in, but then if you want the higher end or more expensive procedures or medications or things like that, or treatments, then you have to pay out of pocket for that still. So I kind of like that it's tiered. So here in America, because we are sort of separated from the value or the dollar amount that the spend in our health care, because the insurance stands in the way of us and our bills.
Right.
It's changing now. We discussed that, but it makes it much more easy for us to say, okay, I want all of this. I want all of these tests. I want all of these procedures. I want this high-end and new medication that's come out because, I don't have to pay as much for it. Because my employer's paying or my insurance company is covering
Where do you
it.
think this opiate, I guess you can say, where people problem. Yeah, I'm trying to figure out. I was going to say crisis, but where do you think this new wave of people looking into that started? How did it start? Because it's a great thing that even the state of North Carolina is starting to stick their foot in it. But where did that start? Who opened their mouth and spoke up? I wonder.
Spoke up out against it?
The opiate crisis, made people recognize, hey, there is a problem.
Yeah, I believe it is coming from the North Carolina Medical Board, and all the reports from the local hospitals about the number of overdoses, the number of deaths that are associated with it, because the health department has to keep up with the morbidity and mortality data that comes from the local hospitals and things like that. And so, all it takes is enough data, and then you give that data to the media, and that. Well,
I would say, the media probably one that started.
Yeah, and then that takes hold, and certain communities that are affected by it will speak louder than others. Right.
So, absolutely.
I think it's just a combination of those things, and then tying the crises, if you will, back to the number of prescribers that were kind of irresponsibly prescribing massive doses of opiates, along with benzodiazepines.
How did they know what they were doing? They obviously knew what they were doing, but just didn't care.
Oh yeah.
Yeah.
So that's we got ourselves into a rut, both prescribing and misusing and abusing it. But I'm glad that North Carolina and other states have the registry.
Starting to recognize that.
Yeah.
That's
and other
great.
ways to kind of protect people.
Well, I know we're getting ready to wrap up soon, but since right now we have that situation, I'm going to call this one about a pandemic. On the last show, we were talking about the difference between epidemic and pandemic for the coronavirus. So I just want you all to recognize that at this point in time, you definitely want to make sure that you keep your hands washed, stay sanitized, try not to shake hands.
The single most effective way of spreading disease.
Give everybody a pound,
good old
not
hand
a shake.
wash, right?
And with this situation, I will say that if it does become a crisis, that insurances, or the health insurance and the government will finally see, let me put it like that, the government will finally see the problem of what health insurances are causing here, because a lot of us won't have health insurance and we're going to be afraid to go get checked. And then if we do get checked, we're going to turn around and get this big, enormous bill that a lot of us can't afford. And so I just feel like what's going to happen is people are going to be afraid to go to the hospital.
Healthcare avoidance, yes.
And won't get checked and won't get quarantined, and then what's going to happen is going to spread even more. And that's just because of the way our programs are set up here. You have more people that don't have health insurance and can't afford it.
That's right.
But have a small business or have a business, and even corporations, and that they can't afford it. But then what's going to happen is it's going to start spreading because they're too afraid to go get checked because they're afraid of what that bill is going to look like.
And that's one of the key things about direct primary care that makes it different from traditional health care, is that we are very transparent about things. So if my patients, if I'm going to do a test or a lab or some procedure or something like that, I'm including them in those healthcare decisions. And helping them to be a better, more informed consumer and to navigate that system a little bit easier.
Awesome. Well, hopefully you all learned a lot today. And again, thanks for tuning in here at WDRB Media, the voice of the community. I'm Doc Bowman. On our show, Discover the Best You. Tune in every Thursday at 2 p.m. You can find my office at discoverychirowellness.com. That's Discovery, irowellness.com. Leslie, tell them how they can find you.
You can find me at 980-949-6000 for a free consultation, or reach me on the web at www.ahawdpc.com.
Awesome. Have a great day.
Thank you.
All right.